A recent report from the Centers for Disease Control and Prevention revealed the fungus Candida auris is spreading rapidly through U.S. healthcare facilities. In addition, the fungus is behind an outbreak in Mississippi that began in November, infecting at least 12 people and potentially responsible for about 4 deaths, according to figures provided by the State Department of Health to ABC News. Although C. auris does not present a threat to most healthy people, and infections are rare, it can affect vulnerable groups of people and can be resistant to several classes of drugs. What is Candida auris? C. auris is a species of Candida, and Candida is the most common yeast that causes human infections. According to the CDC, it's a relatively new type of fungus, being first identified in Japan in 2009. In January 2024, C. auris infection was confirmed in a patient who was recently admitted to Kindred, the public health agency said in a blog post. The patient was tested through a State Department of Health screening program that encourages early detection of multi-drug-resistant organisms, or organisms that can be resistant to treatment, like C. auris, the post said. More than a week later, 3 other cases were confirmed at the hospital, all in patients who had tested negative for the fungus when they were first admitted, meaning the infection had started to spread in the state's first known C. auris outbreak. Public health experts refer to C. auris as an emerging pathogen, which means an organism that has newly appeared or been discovered but has since rapidly spread, either in terms of cases or countries where it is now reported. It is often resistant to antifungal treatments, which means that the medications that are designed to kill the fungus and stop infections do not work, the CDC says. The fungus can cause ear infections, wound infections, urinary tract infections, and blood infections that spread to the rest of the body, per the Cleveland Clinic. Symptoms can include fever, chills, extreme tiredness, low blood pressure, ear pain, low body temperature, and high heart rate. The fungus can spread through contact with contaminated surfaces, clothing, or shared medical equipment, such as blood pressure cuffs, as well as contact with an infected person. People can get the fungus on their skin without getting sick or showing symptoms, then unknowingly spread it, the CDC says. It can survive on surfaces for several weeks. Why is it potentially dangerous? C. auris can spread either from person-to-person transmission or by people coming into contact with contaminated surfaces. This spreads person to person, and we do not think of really any other fungus as spreading person to person in a meaningful way. And it's really hard to kill. Standard Lysol wipes, disinfectant wipes don't kill it. We need dedicated bleach wipes or additional products geared for Candida auris. The other issue is there are strains of C. auris that are drug-resistant, meaning infections caused by the yeast will not respond to multiple antifungal drugs commonly used to treat Candida infections. How is it diagnosed? Patients with C. auris infections are typically diagnosed after cultures of blood or other bodily fluids are analyzed. However, experts said this can be difficult because analyzing these cultures requires updated machines or updated libraries, not all labs of which have the capability. Additionally, it can be hard to identify C. auris on the culture results, and it can be confused with other species of Candida. Who is at risk? Most healthy people do not need to worry about C. auris infections, experts say. However, those with weakened immune systems or who are immunocompromised are at risk of hard-to-treat infections. Additionally, nursing home patients or hospital patients who have or have had lines and tubes in their body, such as a catheter or a breathing tube, are also at high risk. How is it treated? Despite several strains C. auris infections being multi-drug resistant, there is a class of antifungal drugs called echinocandins that can be used and are given intravenously. Maintain the cell wall of the fungus. In some cases, when the infection is resistant to all 3 main classes of drugs, multiple high doses may be required, the CDC said. Are Candida auris infections fatal? According to the CDC, studies are limited, but anywhere between 30% and 60% of people with C. auris infections have died. However, many of these patients also had other serious illnesses that also increase their risk of death. Unless there's a break in the skin or some sort of deeper systemic infection, the risk of mortality or some deeper complication is relatively low unless that fungus gets in a place that it should not be. For example, there's a break in the skin, it gets in the bloodstream, and there's a Candida auris bloodstream infection, and that can be quite fatal. It's Candida auris. It sticks to everything. It can stick to heart valves and stick to catheters. I do want to emphasize that's a rare occurrence, though. What can we do to prevent the spread? There's not much that can be done on an individual level to prevent the spread of the fungus, but the experts recommend avoiding patients with C. auris infections, and that people practice proper hand hygiene when visiting at-risk populations, such as hospital patients or nursing home residents. People also need to be careful about the overuse of antibiotics. While they can be helpful in treating some infections, these medications can kill off bacteria in the gut and give more room for yeasts like C. auris to grow. And if that patient needs to get admitted to the hospital, authorities let the hospital know this patient should be in Candida auris isolation. Don't reuse blood pressure cuffs on that patient and go to the next patient, for instance. Infections that can be serious. More than 45% of people with invasive infections die within the first 30 days. Those in long-term acute care facilities are generally most at risk, largely because they tend to be very ill and rely on devices like catheters or breathing tubes. In general, C. auris is not a threat to healthy people, according to the CDC. Hope you got an overview on Candida auris. We will see you in our next video. Until then, stay safe.